Did you know that the COVID test swabs are not only for sample extraction, but for drug delivery as well? First, we go to National Library of Medicine, reducing false negatives in COVID-19 testing by using microneedle-based oropharyngeal swabs. As you can see from these figures, they're not only for sampling, but for penetration of tissue. So we go over, and you will see in this text, it says fabrication of dually functionalized microneedle patches. Back to the abstract, you can pause and read the whole thing, but it says in the highlighted area, here we engineer regular swabs by using a microneedle patch. It says, moreover, the antibody against the viral spike protein was integrated into the patch. Before we move on from this paper, if you scroll down to the cited by, because cited by means, in the context of research and publications within the National Institutes of Health, a cited by article signifies that another research paper or publication has referenced the original article as a source of information, ideas, or data. Cited by, we have transdermal drug delivery systems for fighting common viral infectious diseases. We have recent advances of representative optical biosensors for rapid and sensitive diagnostics of SARS-CoV-2. We have high sensitivity and point-of-care detection of SARS-CoV-2 from nasal and throat swabs by magnetic SIRS biosensor. There is many embodiments for the COVID-19 testing, but in this video we're going to focus on that the test swabs are a vaccination. As you see in the highlighted area, it says, moreover, the antibody against the viral spike protein was integrated into the patch. What was the viral spike protein? The antibody against COVID-19 is the vaccine. They made these swab ends with a microneedle vaccine printer for thermostable COVID-19 mRNA vaccines. Abstract, decentralized manufacture of thermostable mRNA vaccines in a microneedle patch format could enhance vaccine access in low-resource communities by eliminating the need for a cold chain and trained healthcare personnel. Here, we describe an automated process for printing microneedle patch coronavirus disease 2019 mRNA vaccines in a standalone device. The vaccine ink is composed of lipid nanoparticles loaded with mRNA and a dissolvable polymer blend that was optimized for high bioactivity by screening formulations in vitro. We demonstrate that the resulting microneedle patches are shelf-stable for at least 6 months at room temperature when assessed using a model mRNA construct. Vaccine loading efficiency and microneedle dissolution suggest that efficacious microgram-scale doses of mRNA encapsulated in lipid nanoparticles could be delivered with a single patch. Immunizations in mice using manually produced microneedle patches with mRNA encoding severe acute respiratory syndrome coronavirus 2 spike protein receptor binding domain stimulate long-term immune responses similar to those of intramuscular administration. As you can see in the similar content being viewed by others, we have transdermal microneedles for the programmable burst release of multiple vaccine payloads. That's November 2020. I will leave the link to this because this is literally the paper that shows how they printed off the end of the swabs. It shows you pictures, all that. In the highlighted area, it says they can be self-applied, like at-home testing, are less painful than intramuscular injection, produce no sharp waste, can be formulated to remain shelf-stable for months, and have been used with several types of vaccines, including various nucleic acids. This paper does mention the use of luciferase, just like the shots do. Another article that mentions luciferase with the testing is a nanoluciferase SARS-CoV-2 for rapid neutralization testing and screening of anti-infective drugs for COVID-19. And it tells you that they used an infectious cDNA clone of SARS-CoV-2 strain that has a patent, and they engineered nanoluciferase gene at the OFR7 of the viral genome for it. Back to the vaccine printer for the swabs. I wanted to take you down here and go to the references. Now, look at these. These are all related to this article. vaccine manufacturing capacity in low and middle income countries, development and deployment of COVID-19 vaccines for the most vulnerable. Right here, it's the last mile, COVID-19 vaccines in DRC. Very important, we have dissolvable microneedle patches to enable increased access to vaccines against SARS-CoV-2 and future pandemic outbreaks. Minimally invasive protein delivery with rapidly dissolving polymer microneedles. They even have dissolving polymer blend microneedle patches for influenza vaccines. Microneedles for drug and vaccine delivery. Microneedle systems for delivering nucleic acid drugs. Formulation, characterization, and evaluation of mRNA-loaded dissolvable polymeric microneedles. RNA patch. Manufacturing readiness assessments for evaluation of the microneedle array patch industry and exploration of barriers to full-scale manufacturing. Drug delivery. Speaking of microneedle array patch, let's take a look at the patent for that. Here's the patent for that. This does not cover the whole scope of the test swab embodiments, but I wanted you to take a look at the dates. Very peculiar that it ended whenever they quit shoving them in everybody's heads. So if you scroll down, you can see it says, in the classifications, other apparatus for introducing media into the body percutely, i.e. introducing medicines into the body by diffusion through the skin using microneedles. We have vaccinating by means of needles or other puncturing devices. Check out the rest of those. Now, this patent, smartphone and app for personal pathogen status verification at point of entry into an area of congregation. Look at the date filed. Check out the date of the patent. It says, the use of the words test and testing in this application should be construed to include the confirmed execution of other medical procedures such as vaccination. The test described in this application may be performed using qPCR, nucleic acid detection, or any other method known now or developed in the future that detect viral, bacterial, or other pathogens present in a user's body. The very last page, it says the system of Claim 1 wherein the pathogen test is a vaccination and the pathogen test result is proof of vaccination, and it says at the very bottom, the method of Claim 12 wherein the pathogen test is a vaccination and the pathogen test result is proof of vaccination. Anyways, this patent is for a future scenario in which that you're going to have to take a test or a vaccination to go and do anything. Like, we're not going to go over it in this video, but pause the abstract and read it. But it's literally everything. I'll leave the link available. The correct term for this is intranasal microneedle injection, and it refers to delivering drugs or vaccines into the nasal cavity using tiny, needle-like structures called microneedles. This method offers a non-invasive approach to bypass the blood-brain barrier and reach the brain, or achieve rapid systemic absorption. As you can see, they can be used for vaccine delivery. Right here says, highlighted area says researchers have designed dissolving microneedles that can be applied as toothbrush-like patch for intranasal drug delivery, according to a study published in PubMed Central. Pause and read that if you have to. As you can see, they've done a study where they used a treatment for Alzheimer's the same way as the COVID test swabs. As you can see, there's the tip. Yep. This article explains why they shoved some of them so far in people's heads. This is blood-brain delivery methods using nanotechnology. The existence of the blood-brain barrier, a selective permeability system which acts as a local gateway against circulating foreign substances, represents the key challenge for the delivery of therapeutic agents to the brain. However, the development of nanotechnology-based approaches for brain delivery such as nanoparticles, liposomes, dendrimers, micelles, and carbon nanotubes might be the solution for improved brain therapies. Skipping down, it says the nasal route is preferred over the systemic drug delivery as the drug is directly delivered into the brain through the olfactory bulb, which increases the bioavailability and reduces the degradation of the drug. Olfactory bulb. It's the olfactory bulb and olfactory nerves. You know, like it kind of makes sense, kind of like, yoink. I will leave the link to everything that I went over. I hope y'all check it out.